Hello everyone, this is Chadi Alraies from CVI 2022 in Denver, Colorado. I'm really privileged to be with Dr. Jong Park, who is an internal medicine resident, presented an interesting case at CVI. Jong, thanks for being with us.
Absolutely, it's great to be here.
Yeah, so you are from UT Houston and you work with Dr. Salman Arain, and
Yes.
You've been involved in a very interesting case. If you can tell us about the case.
Yeah, it was actually a multi-level revascularization in a case of critical hand ischemia. The patient has extensive vasculopathy from CAD to PAD, but he essentially had multiple points of interest that we were interested in intervening on, and it looked like he had decent radial perfusion, but the ulnar was almost completely occluded. So it was just multi-stage in all one single procedure in a non-invasive fashion, and somebody who would poorly tolerate surgery.
Yes, yeah. And so what made the patient to identify the problem? Did he or she have an ulcer?
Yeah, actually multiple months. Yes,
yeah.
Actually that's had claudication pain, a non-healing ulcer. I actually saw him in the clinic for the first time, and he had mentioned he was playing with his daughter and accidentally hurt his hand a little bit, and he noticed that the wound wasn't healing, got worse and worse with time.
Oh, wow. Okay.
So that's what really presented him.
Right. So what is the approach, and when this patient any workup done before you take him to the cath lab?
Yes. So obviously in the clinic, good history and physical, but then afterwards we decided first with non-invasive imaging with an ultrasound.
Okay.
Really showed severe stenosis at the brachial artery, and there was a CTO essentially at the ulnar artery.
Yeah.
So that was the first startup, and then we actually jumped straight into the angiogram right after.
Awesome. And what was the angiogram show?
It actually showed a little bit of a beating appearance in the brachial artery, which we were concerned if this is FMD versus atherosclerosis. We were leaning more towards atherosclerosis just from the overall presentation with extensive vasculopathy, but IVUS kind of confirmed that as well. But otherwise, it showed complete CTO at the ulnar artery as well.
Okay.
Yes.
And radial was open.
Radial was actually relatively open, yeah. So we was having good perfusion through, and we saw just a little bit of retrograde filling on the angiogram, and but we felt like it was still worth targeting because he was still having claudication and ischemic pain.
Ischemic. And the ischemia in the territory of the ulnar artery.
Yes.
Yeah.
Yes.
So what was the approach and how you treated?
Yeah. So it ended up being left subclavian access, and we kind of took a stepwise approach. So with the brachial, it ended up being ballooned, and then just going step by step, which was really fantastic. And this is a little bit this is going to show a little bit of my inexperience, but Dr. Arain was really great in mentoring and showing me using this knuckle technique actually at the ulnar CTO, just because it wouldn't bust through initially. So he used that to pull all the way through, and the final angiogram images are fantastic because you see essentially the entire hand, and you see the catheter at the very tip of the finger. So nice. It was a really amazing procedure.
So how did you discharge the patient, and what medical therapy?
So he ended up going on triple therapy actually. He was on anticoagulation with Xarelto. He was on aspirin and Plavix as well. He actually had appropriate follow-up with wound care.
Yeah.
And actually in 6 weeks and a month and a half, everything had resolved. No claudication, the wound was gone. I saw him again in clinic. It was fantastic.
Really? Wow. Yeah. And the claudication and the ulcer,
it was healed. Yeah, with proper perfusion. It was fantastic.
Wow. So this is almost like a limb salvage.
It really was.
Almost lost his finger.
It was, yeah. And he was such a poor candidate for surgery. He has already had surgeries before, just doesn't tolerate it well. So it was fantastic.
Well, that's a great case, and kind of an innovative way, since we're an innovation center, an innovation conference talking about new technology, about treating beyond the legs, beyond the heart, beyond the brain.
Absolutely.
Well, thanks so much for presenting, and congratulations. Please watch these videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. John, thanks again.
Thank you so much.
Yeah.